Hi. I'm here again with Dr. Leanne Rosenberg, and he's been talking about D for depressive disorders. Now, moving on, can you talk to me about how the book came about?
Okay. So I was at another doctor's office when I first started to do clinical research studies, and I wanted to come up with a word that began with D,
Mm-hmm.
and then the letter I, which is loss of interest. So a word that began with D and I, and had 9 letters, and met the criteria for a major depressive episode.
Mm-hmm.
So I'm driving home from the other doctor's office, and I was racking through my vocabulary and came with the word disgusted. It's a 9-letter word. So then I had to match the 9-letter word to the criteria, and it did.
Mm-hmm.
D for depression, I for loss of interest, S for sleep, G for guilt, U for underproductive,
Mm-hmm.
S for suicide, T for thinking, E for energy, D for decreased appetite. And then I went on and wrote about 30 or 40 different mnemonics for each of the psychiatric disorders. It turns out that I realized at that point that every symptom of every disorder is as important as every other symptom, because if I didn't cover every symptom, the mnemonic didn't work. So I started to got me even better at looking at patients. So a patient comes in with the T criteria, thinking, I know that criteria could be part of ADHD, part of bipolar disorder, part of depression, part of PTSD. Maybe think about it, but they could present with that symptom alone, and not with the D or the I. So they aren't necessarily more important. Every criteria is equally important. And eventually I put the book together, hired a publisher, and a printer, and you have it in front of you. That's how it came about, Paul.
Well, thank you. It worked perfectly.
Signing off.
Well, thank you once again. This is Dr. Leanne Rosenberg talking about his book, Major Depressive Episodes. Stay tuned for more. There's much more to come in his Major Depressive Episodes. This is not even halfway through. Stay tuned for more episodes.